Welcome back to the second episode of the Pioneers in Aged Care podcast. Joining us today is Emma Newman, Senior Operations Manager at MercyCare. She's got a couple of interesting full circle moments in her aged care journey. The sponsors for this episode is Keen Care. Click the link below to check them out. Can't wait to share the story with you. Until then, let's go. Welcome to the Pioneers in Aged Care podcast. Here we have Emma Newman, Senior Operations Manager at MercyCare.
Yeah.
We're going to have an awesome conversation today, and we're going to learn all about MercyCare, all the innovations and programs you've implemented. I know I've followed MercyCare's journey for a couple of years now, and I know you guys do push the envelope in what you do, and it's...
We try.
You do try.
Yeah.
And you succeed.
Excellent. We hope so.
All right, so if you could give us, explain to me who MercyCare is, location, services you provide. Just give me an overview. We'll start there.
So MercyCare is a much bigger organisation than most people think. We do far more than deliver residential aged care. So we've got about 1,200 people working across about 48 locations throughout the state, from Broome all the way down to the south. We offer everything from early learning services all the way through to residential aged care and home care services. So it's a the full spectrum of life and everything in between, with a focus on the most vulnerable people in the community.
Not many people know about the early learning part.
No.
What percentage of MercyCare would you say is early learning?
Good question. Gut feel?
Yeah.
I think it's about 30-35%.
Okay.
Aged care definitely takes up the majority. And we have disability services, family and community services, and we support recently arrived migrants, as well as a whole range of youth services as well. But the early learning centres we've got now are all over metropolitan Perth. There's one really close to me up in Banksia Grove that I drive past every day, and you're right, people don't see MercyCare as an early learning provider, but we're doing a lot in that space.
And you've got 5 homes, nursing homes, aged care facilities?
Yep, so Joondalup, Wembley, Kelmscott, Maddington and Rockingham.
Okay,
yes.
And tell me about your home care services.
So again, spanning the whole of metropolitan Perth, all the way from Two Rocks down to Mandurah. So providing home care support, very big growth area, lots of opportunity there. We're certainly doing a lot more in that space to support people to age in place, despite a huge raft of changes that are going to hit that sector in the months ahead. Awesome.
So what have you been working on? Well, what's previous achievements, or what are we looking forward to in the next year?
There's so much coming in the year ahead. My focus really in the next 12 months is stability. So for my team in particular and those around us and our residents, the pace of change doesn't end. It's the constant that absolutely exists in aged care. I'm really looking forward to increasing business acumen in my team in particular. Whilst we are a not-for-profit, we're also a not-for-loss. So we have to be sustainable, we have to be competitive. And supporting my team to really understand all the levers that they have at their disposal to run their facilities is really important.
Tell me about that, increasing business acumen. How do you go about that?
So MercyCare introduced the concept of a business manager into each facility just before my time with MercyCare. So they've been in place coming up for 2 years now, and their focus is to take some of the pressure from the facility manager in terms of rostering, finance, supplies, logistics, all of that sort of the business side of how to run a facility, so that the service manager or the facility manager can actually focus on quality care with a lot more attention to that aspect.
Yeah, right. So you've got your service manager, facility manager, and alongside supporting them is the business manager. Hospitality side. And
then the clinical nurse manager. So that's what I call my local leadership team in each home. And if those 3 people are strong, it's like the trifecta. So you've got someone leading the team who's absolutely accountable, but they're supported with a strong clinician and a strong logistics and hospitality manager, as you said.
You put a business manager in each home?
Yep.
That's not cheap.
It's not cheap, and it's a model we've been trialling, but it's having good effect. So they have responsibility for all of the administration, hospitality and domestic services, so kind of like a hotel manager aspect of it. or the hotel side of things. They definitely free up the service managers to do a lot more in terms of the resident and relative engagement. Noting that our model is at the moment, those aspects of the work are regionalised. So a lot of organisations have those things centralised. We've put them out into the homes at the moment to see how effective that is.
Yeah, because then they can be on the ground, knowing everything that's going on.
Definitely.
Awesome. I think you were going to tell me about this initiative that's launched today.
So today MercyCare has launched our employee value proposition. So what we notice with our collateral for this is there's not a lot of brand on the actual documentation, but it's very much focused on why the employee is important. So we have our characters that have been developed by our fabulous marketing and communication team, led by Carolyn Hall, who is amazing. It's all about making people feel valued. So we know very much that if our staff feel valued, if they feel heard, if they feel recognised, that the quality of the care they give to our clients, and in aged care our residents, is much better. Much better. So
that's awesome. Well, let's have a look at this. Let's show everyone that.
So the main character is the heart, and that's Carey. So that's their name, is Carey. But it's all about, just making the employees feel recognised. There's lots of little things happening. We've got little name badges. Everybody's got a bag with goodies in. The team are out at all our locations today and through the week, actually connecting with our people at the front line. Little things like stickers on the mirrors in the bathrooms saying, it's talking about the reflection that you see and the value that's there.
Yeah. So
lots of really great work to support to make our staff feel valued.
Yeah, absolutely. Can you talk about any challenges that you've encountered since being at MercyCare and how you've overcome that?
Yeah, absolutely. So I've only been in aged care myself about 18 months now. So I joined in a post-COVID, post-Royal Commission era. So many of the challenges are ones which the whole industry is now coming through the other side of. And MercyCare, like any other provider of aged care services, has the same challenges that other providers have. I think for me, the biggest challenge I saw coming in was a level of burnout and compassion fatigue in our staff, which is not unsurprising and again would be common with other organisations. And the work I've been doing sort of in that 18 months is really to focus on building my team, putting in place mechanisms to support them to avoid burnout. So we've just moved to an on-call model with our clinical team, and we're moving to an on-call model with our facility manager team as well, so that people actually can switch off when they get home and refill their cup and come back to work with that energy and that passion again the next day. So that's really important.
And okay, so on this next section, this is the bringing sexy back to aged care segment. And I have to reiterate that the word sexy just means the industry is an attractive place to work. That's the connotation behind it. Because there is an oft-repeated notion that aged care isn't sexy. Every time I go to a conference, every second conversation, someone would say to me, aged care isn't sexy. But it is in its own way. I want to talk about what you think is sexy about aged care, what makes it an attractive industry, what do you love about the industry?
Okay. I've had a range of roles in my time. I came to aged care not really knowing what to expect, but knowing that it was a 24/7 operational environment that really delivers meaningful change for people's lives, which are the two things that get me out of bed in the morning. So it really resonated with me. But in terms of what's sexy about it, the community aspect. So, and when I say community, each home is like its own little community. Like it's got this just group of people who come to work and have fun. And for our staff, they go to work, but they get to go to work in somebody's home. And not many people get to go into that environment. It's a lot more relaxed than some of the acute care settings that we see for clinicians.
There's more connection, more storytelling.
Absolutely. Absolutely. And so much reward with supporting people in that stage of their life where potentially they can do less for themselves and they need more help. It's a really rewarding environment.
Is there, what have you seen out there that you want to do more of? Obviously, every home and organization has their budgets and constraints and what they can do. But if you had access to everything, what's something out there that you would really like to bring into MercyCare, or you just want to see more of?
Yeah, I definitely want to see more collaboration across industry. What I'm seeing at the moment is that providers are so focused on delivering their services that they're becoming quite insular. So the cross-collaboration between organisations is not as strong as it could be. And noting we're all here for our clients, for our residents, our goals are the same. So we're moving into an era where there will be more demand than beds. So competitiveness doesn't need to be the thing that drives us anymore, because there will be plenty of clients, more than enough to go around, in fact, in years to come. So that collaboration and innovation and sharing, I think, needs to be stronger than ever if the industry is going to thrive.
I know there's, we've got a lot of conferences and there's collaboration, at least at the top level, but I can't think of any ground level communities, cross-collaboration efforts. Something for someone to figure out.
Definitely.
Okay, your vision and goals for the next 12 months here?
Building curious leaders in my teams, absolutely. So building leadership where people actively look for information themselves and drive change. Empowering my team to push the envelope. So you mentioned before, MercyCare does push boundaries. My team are doing that more than ever. That's really important, but also looking for opportunities to cut red tape, particularly where it's red tape that we've put in place ourselves. So we're, like any organisation, we're quick to put in policy and process and procedure, but if we tie ourselves up in knots, we won't deliver services well. Yeah,
I love that. When you say if it's something that you put in yourself and you're willing to remove it, it just shows a lack of ego and just a willingness to commit to moving forward. Yeah, that's awesome.
An example of where we're looking at that at the moment is volunteering. So having come from St. John, they have a fantastic volunteer base, particularly in the regions that ambulance services couldn't survive without the volunteers at St. John WA. We have seen a lot of volunteers drop away, particularly during COVID times, and the cost of living now means a lot less people can afford to give their time free to volunteer. But some of the red tape we'd put in place was people need to come for a minimum number of attendances per week and a minimum amount of time per week. And it was always Monday to Friday, sort of 9 to 5, when there were staff on site to support them. So we're doing away with that. So people can come when they're available, for how long they're available, whether it's once a month for an hour on a Saturday afternoon, or if it's on a Wednesday evening for 30 minutes on the way home from something else they've been doing. So really opening the door to that cohort of people.
Okay, let's go through your career and how you got to this point, because it's always interesting to see. So yeah, like you said, 1 year and 8 months at MercyCare, Senior Operations Manager. You started as their Acting General Manager, moved into the Operations Manager role and promoted July 2024 last year into the Senior Ops Manager role. Prior to that, board member for 10 months at the Lord Mayor's Distress Relief Fund. Chief of Staff at City of Perth for a year. And then St. John WA, 2 years, 7 months, Operations Manager and Acting Head, Metropolitan Ambulance Operations. Australian Public Service, Chief of Staff again for 5 years, 3 months. So that human resources, people and culture, you're very strong in terms of that background. And no wonder you're implementing and looking after your staff and trying to build them up. Love that. So how did you get into aged care from there?
So I left university and went into immigration in the UK. I was there for about 8 years, then moved to Australia. Never looked back, by the way, and I'm definitely not going there. This is home.
Yep.
Was fortunate enough to get a job with what was then the Department of Immigration and Border Protection, which became the Australian Border Force, and then into St John and then Chief of Staff. When I went to the city of Perth, I was there for about 12 months. It was the first time I'd done a job that wasn't in a 24/7 operational environment. And I'd get home and there was no emails and no phone calls. And for a while that was lovely.
Yeah.
And then I sort of thought, I'm not giving everything I possibly can. And that need to give back is strong. It drives me. So I started looking for other roles as well, which were more aligned to my values and where I fit. And this came up. There were several people that had gone from St John to MercyCare. So our current CEO, Anthony Smith, and we've also got Phil, who's our executive director. They both came from St John, although they left St John before I joined. Yep. So I didn't know them, but I knew of them.
And interesting. There must be some sort of pathway or internal nudge there.
Yeah. I didn't see it, didn't experience it, but there's certainly, and Perth's small, so people do move around and networks are strong.
Yeah.
But it was interesting to know people had gone from St John here. So the operations manager role came up. It was a newly created role, and it aligned to my values and what drives me. So.
And that's the thing about MercyCare. A lot of aged care organisations would want aged care backgrounds, and I have noticed MercyCare have really looked outside the box and looked for fresh thinkers.
Yeah. And that's a common theme. So you're right, there's a myth that to work in aged care or to be successful, you have to have an aged care background. And that's all the way through from your senior executive all the way through to your facility managers and your teams there, even your nurses. There's a drive for, we need nurses with aged care experience. Actually, what you need is people who are curious, who are smart, who can learn, who care. That's what you need. Because you can teach people subject matter. Yeah.
And I think if the organisation is structured in the way that they can support people without that experience, then you can definitely do it. I think there are a lot of organisations who just don't have that capability, capacity, or resources to dedicate to helping people from the ground up.
Yeah.
But the fact that MercyCare can hire from outside means that you've got robust support systems there.
It's not without its challenges. Bringing someone in who doesn't have aged care experience, there's a lot to get across. But each time we bring in someone new, we learn ourselves about something else we need to tell them, or a document we need to share, or policy they need to be across, or webinars they can go to get help, and networks we can build. So there's so much we can do to bring in fresh thinkers.
How would you feel about it if people were sitting here?
Wouldn't bother me at all. But I'm reasonably comfortable in front of the camera.
You definitely are.
I would, but the first thing I'd have been said is, can I bring someone from my team? Because I'm all about upskilling. So trying to give them opportunities to observe what I do, the meetings I go to, the things I do, so that if I want to go on holiday, which I love to do, they are more confident about the role. So
I'm gonna do that.
I think you'll get a lot of uptake, particularly around comms and marketing as well, assisting you, because it's in the organisation's interest as well that their brand is protected. So
okay, we've got a question from our sponsor here. Our sponsor is KeenCare, and this question is from the founder, Arav Kumar. His question is, as we all recognise, progress notes are essential for tracking a client's progress in aged care and home care. Given that our carers come from diverse backgrounds, which can sometimes complicate documentation, what innovative solutions or strategies do you believe could help our staff write more effective and comprehensive progress notes?
Okay. So reflecting back to when I was at St John, the paramedics are in the same situation, and particularly for paramedics, timing is everything. So they have a very small window from when they provide treatment, then they've got transportation to emergency, and then they have to hand their patient over to the hospital, and they've got to hand over with as much information as possible. So one of the things that was introduced in my time at St. John was talk-to-text functionality with electronic patient care records.
Mm-hmm.
And I think that's a real missed opportunity in aged care. The bit that's missing, as you identified, is it's a diverse workforce. So adding in a translator capacity into talk-to-text functionality, I think will make the world of difference. So we commonly see staff where English is a second language, and what they've written isn't necessarily what actually occurred or what they meant to say. Particularly if you're doing an investigation on there's been an incident, you have to go back and clarify a lot, which takes time. So having the opportunity for staff potentially to document in their native language and that to be converted and to be done verbally, I think would be a huge win for the industry. It's much quicker as well. And there's a lot of AI now sitting in the background that can work with whatever the content is to capture key points. So I know Regis have just done, or they're working on a project, a trial with artificial intelligence and progress notes for their nursing team. There was an article published, I'm going to say 2 weeks ago about that, which they're exploring, and it's costly, but I think for the future, if we really want clear documentation, quality notes, evidence-based information to work with, it's got to be the way to go.
Okay, the next question I have, so we're going to get into your story now, and so people can connect with you. I think one of the things about aged care and people with senior job titles, and I'm just speaking from experience, when I approach someone and try to network and get to know them, if they've got a really senior title, I get a little nervous. But if I knew you were into like poker or basketball and I saw you off in the distance, I heard that on a podcast, I'd be like, Emma, what team do you follow? So this is a chance for, or this next part is a chance for people to connect with you and follow your journey. But before I do, is there anything we missed about MercyCare in your role here that you want to cover?
No, I think we've covered a lot of it. I think having been a relatively new entrant into aged care, I've still got a different view to a lot of people. There's so many missed opportunities in aged care, and it doesn't have to be huge innovation that costs millions of dollars that solves the world. It can be the smallest things. So I'd strongly advocate for people without aged care experience coming into the industry and bringing their wealth of experience and background with them.
Yeah. Okay, so the question I'm dying to ask is, what's a topic that if someone got you started on it, your friends and family would say, don't get her started, she'll never stop? What is that?
Most recently, it would be New York. So
New York.
Had the opportunity to travel to the US for the first time late last year.
So
with
you
my
came
daughter.
back and made everyone jealous with your constant chatter about New York.
They talk about it being the place you fall in love with, and that sounds really corny, but it's so true. So true. If I won billions of dollars in lotto, I would definitely move.
When did you go?
Yeah. We went in September last year.
Nice.
For a month. So we weren't in New York. Well, we were actually in the US for a month.
Yep.
We did Florida for a big chunk of that. So my daughter's 15, so it was Disney and Universal and every ride imaginable. And then we went to New York and pretty much tried to do every single thing you could possibly do in New York.
How much time did you spend in New York?
We were there for just over a week. Yeah, it's about a week and a half.
That's not enough time, is it?
We were on the go from 6 a.m. till 10, 11 at night without stopping. And luckily my 15-year-old is very resilient.
Yeah.
So we walked everywhere. We did everything, like numerous things every single day. We didn't come home with any regrets.
Let's say you booked a flight tomorrow. Where's the first place in New York you would go to straight away?
Or Broadway, back to see Hamilton, the musical. So that was her request and it was, fantastic. Otherwise, there's so many places. Central Park was beautiful. It's hard to reconcile that in the middle of New York.
Yeah, I think Central Park would be the size of Perth.
Yeah, it's insane, but it's just there's so much you can do everything or you can do nothing in New York. There's so many opportunities. Love it.
I love that.
Yep. Obviously, come from the UK originally. Very tiny family. Most people, the family tree gets bigger. Mine goes in the opposite direction, so it actually ends with my daughter. My dad was a paramedic, career paramedic, so going to St. John really felt like I was
Like
doing something in his memory. Both my parents have passed. My mum actually ran an aged care facility in Wiltshire in England, a nursing home. She was a nurse, again, a nurse by career. So now I feel like I'm doing some justice for her as well. And everything I heard when I was little and growing up with a nurse and a paramedic for parents working opposite shifts now has come home to roost, and I sort of have a lot of insight, even though I haven't worked in the industry before. And my other relative is my aunt. She's 92. She lives in Scarborough in England. And I speak to her via FaceTime twice a week, and we play Scrabble every single day on the app. So it's really interesting now being on the other side of aged care.
You play Scrabble with your aunt twice a week through
Scrabble every day, and then FaceTime twice a week. So we use the Words with Friends app. And it's actually just a really nice way to still connect without speaking every day. She is adamant she's staying at home. I've been able to, the world's an amazing place because I've been able to put so much support in place for her, despite the geographical distance and the time difference. So again, that's another connection to me as to why it's really important we look after people no matter the circumstances or the location.
I can tell.
And we have a greyhound called Tom Cruise.
Do you call your greyhound by its full name?
Yes.
Every time you're recalling.
Yep. Come on, Tom Cruise, it's time to go for a walk. Yep. And my friends will say, is Tom Cruise coming? Like if I'm going somewhere, and other people turn around like, what? He has to be called Tom Cruise because my fiance is called Tom. So if I shorten the name, nobody knows who I'm talking about.
How did you come up with that name?
That was his racing name, so he's a rescue.
Oh, okay.
And when we got him, I just thought you wouldn't, if you adopted a child at 3.5, you wouldn't change their name. So his name was Tom Cruise. So it stuck.
I love that.
It stuck.
And so now it all makes sense going through your history, because if someone looks at your LinkedIn profile, they're thinking, how did she get into aged care? That's pretty awesome. She fell into it. But knowing the history and the background and how it's come full circle, I love that story. And MercyCare has this sort of full circle thing with the early childhood learning centres and the aged care as well. Yeah, it's
a fabulous place to work. I don't think I've ever felt as at home anywhere else I've worked. The MercyCare really does live the values. It's not just a case of having 6 values that are listed on the wall and in all of our documentation. That everything that MercyCare does connects to the values. And if you can find a place where your personal ethics and your morals and your values align with your employers, I just think that's fabulous, because you get to live life once. So you really have to love what you do.
Emma, thank you so much.
No worries.
Appreciate it.
Thank you.
Cheers, guys.